What do high CK levels mean for muscular dystrophy diagnosis? Imagine a tiny alarm bell ringing inside your body that signals muscle trouble. That alarm bell is often a blood test measuring creatine kinase, or CK. When muscles get damaged or break down, CK leaks out of the muscle cells into the blood, causing levels to rise. This is why high CK levels are important in diagnosing muscular dystrophy. In muscular dystrophies like Duchenne or Becker, CK levels can be extremely high. In Duchenne muscular dystrophy, CK levels can be 10 to 100 times higher than normal, showing ongoing muscle damage. In Becker muscular dystrophy, levels are also elevated but usually less dramatically, sometimes up to 5 times above normal. These high levels reflected that muscle tissue is being destroyed by an abnormal process. However, it's important to remember that high CK levels are not exclusive to muscular dystrophy. They can also be caused by other factors like muscle inflammation, injury, intense exercise, or certain medications. So, a high CK level alone doesn't confirm muscular dystrophy. It's just a clue that something is affecting the muscles. When doctors see elevated CK, they use it as an initial screening step. They will then order more specific tests to confirm the diagnosis. These include genetic testing, which looks for mutations in genes like the dystrophin gene that cause Duchenne or Becker muscular dystrophy. A muscle biopsy can also be done to examine muscle tissue for characteristic changes. Electromyography, or EMG, measures electrical activity in muscles and helps distinguish muscle problems from nerve issues. Because CK levels can vary widely among individuals and can be elevated for many reasons, doctors always interpret these results in the context of symptoms and other tests. For example, a person with muscle weakness and very high CK levels might be more likely to have muscular dystrophy, but confirmation requires genetic or tissue analysis. In summary, high CK levels are a useful early indicator of muscle damage and can point healthcare providers toward further testing. They are an important part of the diagnostic process, but do not provide a definitive diagnosis on their own. Always consult a healthcare professional for personalized evaluation and guidance.